everyone. I'm Michelle Cassidy with the Florida Aviation Network. Right now we are live and in the clear at Sun and Fun, the 41st anniversary. And now I am joining you with actually Dr. Busch from Stallion 51. So how have you been, Doctor?
I've been outstanding, and you?
I've been great. So how's your Sun and Fun going?
Sun and Fun has been a good year so far. The weather's cooperated. The flying's been outstanding. So no gigs, and it's Saturday noontime, so things are looking good.
We've actually met a few times before this. I've been working here for 3 years, and you've been coming year after year, which is amazing.
This is your third year of interviewing me.
Yes, it is.
Third? Yeah.
Yeah. I was actually sitting on the other side of the event, and now I'm in the hot seat.
And I understand you recently got your diploma, and you're going into audiology.
Yeah, and it's almost in the same field as yours. You work in ophthalmology.
Audiology is very important in aviation with the hearing of pilots. And even more so with air traffic controllers, the FAA controllers that work in the towers and for the flight centers, they have routine audiology performed on them all the time to make sure their hearing is up to speed.
Yeah, I've noticed that we're actually since we're in the same field of face, as I like to say, you get a lot of pilots from basically around the world, and you keep them in the cockpit, like you keep them there, right?
True, and I do have a lot of pilots come into my clinic from basically all over the country and even the world. It's kind of interesting because we have a lot of flight schools here, and then of course we have people coming to Stallion 51 to sample the P51 and our other programs, the flight programs, and they come through my clinic. And so it's a unique experience for me to have people from every continent, and I ought to probably figure out how many different countries, but to be honest with you, there's some people that have come to my clinic that I didn't even know that was a country.
So you're involved with basically the whole process of them actually being able to get their license as a pilot, right?
Well, I mean, I'm an FAA aviation medical examiner, a senior AME, and yes, I mean, I do the medical part. I have a CFI pilot rating, but I technically don't do much instructing. However, within the complex and the different protocols and training evolutions we have at Stallion 51, I do give ground school in aviation physiology and spatial disorientation and that sort of stuff. So a little bit of that involved with getting the pilot license, but basically it's mostly the medical thing. They go back to the flight schools and start and just go straight through.
That's amazing. What I really like to think about it is, like, most people think that when you're flying you need your sight, like that's the 100% that you need. So, but that's not true in most cases. In most cases, people are not essentially blind, but they don't have 100% seeing, correct?
Well, now, I'll make a comment on that because, you know, humans have what they call 5 senses, right? 5 senses. Of the 5 senses, I would say that the vision sense, the sense of vision or sight, is definitely the most important for aviation.
Yes.
I mean, if you lose the sense of taste, you could still fly an airplane pretty easy, or smell, or even hearing.
Yes.
But when it comes to sight, you have to have vision to fly in today's world and in the world of previous flight evolutions. In the future, you never know. There's development with proprioceptive bodysuits. They can tell the pilot where he is in time and space, but that's not now. As far as degraded sight, yes, you can wear glasses, you can wear contacts, you can have a laser surgery to correct your vision. You can even have one eye and fly an airplane.
Okay.
Basically, if you just need a little glass, that's considered pretty normal. Now, if you get to where you have eye diseases and degraded vision, and even are missing an eye or useful vision of one eye, then they have ways where you can get what's called a special issuance or an acceptance to policy if, as a pilot, you show your efficiency in performing your duties with perhaps one eye or bad vision. And one more thing, there are limitations to that too, so I'm almost done, but for the Class 3 pilots who are non-paid pilots, non-commercial and non-airline guys, they have a certain vision standard they have to meet. And then the airline pilots and the commercial pilots, the Class 1 and Class 2 pilots, they pretty much have to be correctable at least a 20/20 in each eye. Otherwise, they need to go through the alternate acceptance to policy special issuance process.
That's interesting, because if you think about it, if you have one eye, it's different than experiencing full vision in both eyes. would the person with like one eye or like some sort of disorder or disease have to go through a special sort of training if they just like lost that vision like recently?
If there's kind of a lot to it, but the reality is if you have useful vision in only one eye, and it has to go for a certain period of time. Like if you have an injury, I can't remember the exact date, but I think they want you to be, they want you to acclimatize yourself to vision in one eye for, I believe it's a year. Then after that, you can go before the FAA medical guys, and they will give you permission to go before the FSDO to apply for a statement of demonstrated ability, which is also like a waiver or a special issuance, except it's for a condition that's not expected to change. Like vision in one eye, you would get a statement of demonstrated ability, or deep no color vision, you would get a statement of demonstrated ability. It's pretty much a one-time check, and it's for a permanent condition, not a condition that may change, such as heart disease or diabetes or something.
Okay, because sometimes I would get confused with a lot of that. You would think that having one eye or some sort of thing that holds you back, it's not really holding you back. It's sort of just a limitation, an obstacle in order to actually achieve
having
that.
one eye, after you get used to it, I mean, yes, it's a little bit of a limitation, but it's mostly in your field of vision. And maybe fine stereopsis because you only have one eye. But people that have been functioning that way their whole lives, they really are not limited from doing much.
Yeah.
I mean, they can become doctors and lawyers and pilots and all this sort of stuff. So it's just what you're used to.
How would you say you're involved with the whole process of getting that accomplished?
Well, you talking about specifically the eye thing or just the special issuance in general?
In general.
To get a pilot medical in the class 1, 2, or 3 categories, 1 being airline predominantly pilots, 2 being commercial pilots, and 3 being private pilots, non-paid pilots, I am the guy that gives those, and that's what I do. If the person meets all the standards without any problem, and they come to me and I give them the exam, which is everything from mental to physical, and I'm comfortable that they pass and they meet all the standards, I give them their medical certificate in whatever category that is. If they have a problem that disqualifies them from one of those categories, and that can be any form of disease that's disqualifying, heart, lung, diabetes, the list is endless, even psychological things. If they are found disqualified, then what I would do is I would advise the pilot, and we would make a plan to contact the FAA and apply for what's called an authorization for special issuance. Authorization for special issuance. What that really is that's a waiver or exception to policy. In other words, it's the FAA saying, we know you got this disease, but because you've proven that your disease is stable and it's treated and everything's fine, we will now give you your medical certificate even though you have this disease.
So that's the whole having to do with keeping in the cockpit, trying to keep the pilots in the cockpit.
And that's the whole waiver process. The military calls it a waiver. The FAA calls it authorization for special issuance. It's a special issuance. It's a big thing because, there's tens of thousands of pilots out there that have, quote, disqualifying conditions. And if they work through their AME, and their AME works through and liaisons with the FAA, 98% of the time, the pilot will get a special issuance and be allowed to fly, even though he's got a technically disqualifying condition.
Do you run into these complications a lot when giving out eye exams?
Well, I mean, the eye exam is not really the major disqualifying thing for my population, especially in the older population. When they get, the guys and the gals get a little up there in years, they get things like high blood pressure, diabetes, heart disease. Those are the main ones.
So you're involved with the whole spectrum of everything.
Right, I do the whole thing. I mean, the eye thing is my specialty, and all that, but I do the whole thing.
So you get confused with that a lot. Some people assume that it's basically the eye, but when you're like, you can basically do the whole spectrum.
Well, the eye is probably the most important
sense.
Yes,
of course.
And you have to you can fly without an arm, but you can't fly without vision, right?
Yes.
So I focus my postgraduate studies on ophthalmology because of its aviation application. I mean, to be honest with you. I mean, I said, what specialty will give me the greatest insights into aviation and what specialty do most guys don't have a clue about. So I picked that one.
How did, could you just go in a little more depth of that, how you came from acknowledging the fact that this is the most important thing out of the whole spectrum of
Well,
senses?
now remember from past years when we interviewed, I did not start my life as a doctor or even wanting to be a doctor.
Yes.
I started on the farm and I started, you know, baling hay. And then I went to college and I still was an athlete. And then I went to the Navy and I became a naval aviator and flew off aircraft carriers. And then all of a sudden I decided to become an adult, so I applied to medical school and went to medical school, and then came back to the Navy as a pilot physician, an aviator flight surgeon. And so my evolution has allowed me to focus on what I think is important in aviation, and that would be accumulation of all those years of experience is one of the reasons why I picked the ophthalmology field to go into.
That's amazing. So you did have, tell us about your previous experience when you were flying, because that seems pretty interesting, knowing that you actually did fly and then you wanted to branch off into something else. And
Well, I mean, I'm going to throw a plug in here because I was in the military, and if you're energetic and you perform and you know, I mean, the military is the most awesome thing that I can recommend for anybody. I mean, that's where I learned everything that I can do other than, you know, drive a tractor. So the reality is it was awesome, man. You know, they'll train you and then you work for them, and then once you're done working for them for a certain period of time, they may train you to do something else. And so I owe my greatest thanks, and the #1 greatest decision I ever made in my life was to join the United States Navy.
nice. So basically, you got so involved with the fact you got more into it, and they worked with you more and more and more until you decided, oh, I want to go into doctoring now. Or is that how it worked?
Well, I mean, I don't know what that really meant, but
Well, I mean, like, you started out.
let me tell you, I was an aviator, but there's always these programs going on. I mean, anybody can apply for anything.
Yes.
I mean, you can apply to go in the military as a doctor if you want to.
Yes.
Now, I will admit, you're years away in studies to do that.
Yeah.
But you could target that right now, and you could even apply for them to pay for your medical school.
Yes.
And you can do that for other things too. You can start thinking about going in the military as a pilot, or as a lawyer, or as a supply corps person. What do you mean supply corps? Well, they train you how to procure stuff and pay for stuff. Same thing major corporations do. I mean, the budget of an aircraft carrier is hundreds of millions of dollars per year. If you're the supply officer for that ship, you get a lot of valuable experience. And you do that at a young age, right?
Yeah. That's pretty interesting. Now, is there any plans that you have as for the future, as maybe involvement with Sun and Fun even more, or doing anything beyond
Well,
that?
you know, usually we do a radio and the TV and a few interview things. This year I did a new evolution. It was called a forum. It was an hour lecture. I provided a lecture yesterday for an hour to a bunch of aviators, and it went over pretty good. I entertained myself and hopefully them.
Do you mind telling us what you talked about during the forum?
Yesterday?
Yes.
Well, first of all, I talked for a few minutes about the Med Express. You know what the Med Express is?
No.
In 2012, the FAA had been maneuvering, but they drew the line in the sand, and after October of 2012, there was no medical forms being filled out longhand. It had to all be on the computer. And that was the FAA Form 8500-8. Okay, so as of October, no more paper for the FAA medical form when the pilots would come to the office.
Yeah.
Now the pilots have to go on and create an account, have a password and whatever that other stuff, a login number and a password, so they can add that to their other 50 that they have to check their checking account. And then they create this account, and then they do the medical questionnaire thing, the FAA Form 8500-8 on the computer, and then they submit it to the FAA, and then they come and see me. And then I pull it up and do it. So it's a paperless thing. The reason I talked about that is there's a lot of people out there that still don't know about it. And probably 2 or 3 times a month, I have pilots come into my office to get a medical, and they haven't done that. And it takes about an hour or an hour and a half the first time you do it.
Yeah.
So I briefed them on that, and they were receptive. You guys learned a few things. And then I went into a topic I had many topics. I had like 20 topics because it was kind of open, so I let them pick. But the one I decided to do was alcohol drinking.
Okay.
Drinking in pilots.
Oh.
Ethyl alcohol.
Yeah.
You know, whiskey, wine, or beer, wine, and distilled spirits. So we had a nice 30-minute lecture on that.
Everyone wants to talk about.
Well, it's common, it's legal, it's on TV, it's in the restaurants, it's all over the place.
Yes.
And there's no, you know, drinking. There's nothing wrong with drinking. The Surgeon
No,
General
it's
has said that.
nothing wrong.
The Surgeon General says a couple of drinks a day could be good for your heart. But the reality is, for pilots, it's not about that. But you don't want to get in trouble with drinking as a pilot, because not only do you get in trouble with the local police, the county guys or the state guys for their driving thing, after they're done working you over, then the FAA is going to work you over if you're a pilot and you had a DUI, for instance. Okay? So for a regular citizen that works, you know, as a real estate agent, they're going to have if they have a problem with alcohol, like they have a DUI or something, they will have a big problem with the county, for instance. Fines, lose their license, and all that other stuff. If you're a pilot, you have that, plus you got the FAA thing now. So I was giving them a lot of warning about that. You know, be careful, don't be doing that stuff. Of course, you wouldn't know because you're only, what, 18?
I'm 17.
17, so.
Yeah. So, I'm trying to think about some.
Well, let me ask you a question. Once you go into audiology, are you going to do that for your life's work, or are you going to do something else?
Well, I want to do a lot of things. It's not just that. I mean, there's a lot you can do. I'm young, obviously.
And you're 17.
Yes.
And the thing is, which is impressive, is you're going to have your AA degree.
Yes.
You have your AA degree at age 17. That's
Yes.
impressive. So you could technically go on to school for 2 more years and have your bachelor's degree when you're like 19.
Yes.
Oh, girl, come on, give me that brain. Let's go do something. You need to get signed up. How's your vision? Can you qualify to be a fighter pilot?
I'm wearing contacts, but that's just about it.
That's no problem these
Yeah.
days. We'll fix that.
Yeah.
So,
Actually, before I was starting out, when I was figuring out what I wanted to do, my mom actually considered ophthalmology. She wanted me to try it out and try something about it.
well, ophthalmology requires an undergraduate degree, 4 years of medical school, and then 4 years of after medical school training. And you could do that and have that done by the time you're 30.
Wow. And so for anyone who actually wants to do that, who's a pilot, maybe has some sort of interest in going to something medical, possibly ophthalmology, do you have any advice for them or something?
You mean a pilot that wants to become an ophthalmologist?
Or anyone who wants to become an ophthalmologist?
Well, get yourself in medical school. If you get through med school, then you can be an ophthalmologist. And it's hard to get into med school, so
Yes.
there you go.
Well, you obviously have a lot of experience. How long have you been doing this? And if not,
Well,
too
I
much?
mean, I'm kind of old, so it's been a while, but I don't have any inherent skills. I didn't
No.
inherit anything, and I wasn't born with anything. I just live by a philosophy that was stated by Calvin Coolidge. There's nothing in the world that'll ever take the place of persistence. If you set your mind to it and you stick with it and you don't give up, you will be successful most of the time. And that's how I've lived my life.
That's a good
That's
philosophy.
basically
I
it.
love that. It also, for those who are prone to procrastination, someone needs that motivation. They need that persistence.
You got a good start, though, because I like to brag that the fact that I didn't read a book till I was a college graduate.
Wow.
Now look at you. You have a AA degree and you're only 17. That's awesome.
Well, thank you for joining us today. It was great having you.
Thank you. I enjoyed it too.
Well,
Very good.
This has been Michelle Cassidy with Dr. Busch from Stallion 51, and I've been Michelle Cassidy with the Florida Aviation Network, and we're here at Sun and Fun enjoying all the joy there is here. So thank you for joining us.
Very good.